Restasis ophthalmic emulsion for increased tear production. Reduce your artificial tears. Increase your own tears. If you have dry eye disease, you are not alone. The fact is, millions of Americans have the same condition you do. Nearly 3.2 million women have it, including 1 in 12 women over the age of 50. You're more likely to suffer from it as you get older, enter menopause, or have certain conditions such as rheumatoid arthritis or diabetes. Dry eye disease is the second most common reason why patients visit their eye doctor, so it might be why the patient sitting next to you is here today too. When you have dry eye disease, it could mean you need to make more of your own tears. But this is one condition for which you have treatment options.
Dry eye is a chronic condition, which if left untreated can lead to decreased vision and increased risk of infection. So it's important to see your eye doctor for the appropriate diagnosis and treatment.
What causes dry eye disease? One reason is that your body stops making enough of your own tears. Fewer tears, less of the moisture and protection your eye needs. And as you may know, dry eye disease doesn't just go away on its own. If you don't treat it, it can get worse over time, not better. Now, if you're like most people with dry eye disease, you've been taking artificial tears, over-the-counter eye drops like these, for your dry eye. But as you may also know, they may not be enough. These drops provide only temporary relief, and they are artificial tears. They do not get to the core of the problem, the reason why you may not be producing your own tears to begin with. So you find yourself using more and more of them as your condition gets worse and worse. But there is only one eye drop that does help you produce more of your own tears. Restasis cyclosporine ophthalmic emulsion, 0.05%.
If they're willing to put something in 4 times a day or more, that's someone who may benefit a lot from Restasis.
Restasis ophthalmic emulsion, available by prescription only. Simply place 1 drop of Restasis in each eye, twice a day, every day. Simple as that. Now, you won't feel the full effects of Restasis ophthalmic emulsion right away. It may take a few weeks or even a few months, but Restasis will help you begin producing more of your own tears before you know it. Please note that you should not use Restasis ophthalmic emulsion if you currently have an eye infection. In addition, Restasis has not been studied in patients with a history of herpes viral infections of the eye. A burning sensation is the most common side effect, occurring 17% of the time following the use of Restasis ophthalmic emulsion. Just be patient and stick with it. Other side effects include eye redness, discharge, watery eyes, eye pain, foreign body sensation, itching, stinging, and blurred vision. You may sometimes need those artificial tears to keep your eyes moist. That's okay. If you do, use artificial tears like Refresh brand tears as often as needed. In time, you may find yourself using fewer and fewer artificial tears when you begin producing more of your own tears with Restasis.
In the past, all I've been able to do is treat my patients with artificial tears rather than treating the cause of the problem.
A few moments ago, you heard that there's a good chance other patients in this room have the same condition you do. Well, there's an equally good chance that they're already using Restasis ophthalmic emulsion. It's been prescribed over 1 million times. So if you think it's time to start replacing artificial tears with more of your own, you've come to the right place, here in the doctor's office. When you're called, ask the doctor if Restasis is right for you. Restasis ophthalmic emulsion for increased tear production. Reduce your artificial tears, increase your own tears. Restasis cyclosporine ophthalmic emulsion, 0.05%, is available only by prescription. Please see the full prescribing information that has been provided to your doctor.